Well, hello there, and welcome to Medicare Made Plain, brought to you by AssureSource. We appreciate you stopping by today and talking about Medicare Part A. You know, anytime that you build anything, you have to have a good, firm foundation. And so we thought it would be a great place for us to begin kind of some basic training about Medicare by starting with just regular old red, white, and blue Medicare Part A. So again, thanks for stopping by our little place of business, and let's get started talking about Medicare Part A. So again, as we start to build this foundation, today we're going to talk about Medicare Part A. But I thought it would be a good idea to get a kind of a 10 or 15,000 foot view of all of the A, B, C, and D's of Medicare before we get into the details of Part A. So let's start with talking about Part A. Part A is your hospital coverage. You'll hear me start to beat this dead horse that you have to be admitted into the hospital before it's actually covered under Part A. Part B then is your medical coverage. So if you go to the doctor, you go see a specialist, you have anything done outpatient, it's going to be covered under Medicare Part B. Part C then is Medicare Advantage. And then Part D is your drug coverage. So if you are admitted into the hospital, it's covered under Part A. If you do anything outpatient or you go see your doctor or a specialist, it's covered under Part B. Medicare Advantage falls under Part C, and your prescription drug coverage, at least most of them, are covered under Part D. So let's go ahead and start talking about the details about Part A. So let's talk about exactly what Part A covers. Again, Part A covers inpatient care in the hospital, which means that you have to be actually admitted into the hospital before it's covered under Part A. When we talked about Part B in another video, we'll talk about observations, and that's really why we talk about the fact that you have to be admitted into the hospital before it's covered under Part A. Observations can be up to 72 hours, which means that they can hold you in the hospital for 72 hours without ever admitting you into the hospital. A lot of times it looks like something like this. You go into the emergency room, they say, we don't have a room available, we don't have a bed available, we're going to put you over here for a little while, and that's an observation. The problem with that is you never actually get admitted into the hospital, so you never go into Medicare Part A, and you stay in Medicare Part B. The cost sharing on Medicare Part B, in other words, what you have to pay out of your pocket, is 20%. So 20% of a 72-hour hospital stay can be quite exorbitant. The second thing that Medicare Part A covers is skilled nursing facility care. The caveat or the rule on this is that you have to be in the hospital for 3 midnights. This is called the 3 midnight rule. It's not 3 days or 3 noons. You have to be in there for actually 3 midnights. And then if you need skilled nursing facility care, it's covered under Medicare Part A. I actually used this not too long ago. I had a client that went to had to have some surgery in Ohio at the Cleveland Clinic. It was some very complicated back surgery, and she was in there for about 10 days. Well, when she got out, she needed some therapy that needed to be done in a skilled nursing facility. Because she was in the hospital for 3 midnights, it was then covered under Part A of Medicare. The third thing that Medicare Part A covers is hospice care. Nobody likes to think about hospice, but death is a part of life. And so first off, we talked about what are the rules when it comes to hospice care. There's 2 of them. First off, a doctor has to say that this individual has less than 6 months to live on average. Now, this is not something that's good a lot of times or easy for the family to deal with and to swallow, but that doesn't mean that they are only in hospice for 6 months. I've seen people be in hospice for 5 or 6 years. It just meant that they stayed kind of at that death's door, that position where they felt like that on average somebody in this situation would have less than 6 months to live. The second rule, and by far the hardest thing for the patient and for the family to deal with, is that there is no more treatment. So when somebody goes into hospice and it's cancer, there's no more chemo. If it's something that's heart, there's no more heart medicine. It's all about making that person comfortable as they go through that transition in life. What I want you to know about Medicare as it pertains to hospice is that it doesn't matter what insurance you have, whether you have an Advantage plan, whether you have a supplement. Hospice care is always covered under regular old Medicare Part A. So it doesn't matter what insurance you have, it's always covered under Part A. And that's everything that is included in hospice, whether it be medicine, hospitalizations, ambulance rides, doctor visits. There's even some opportunities to have some counseling, even spiritual counseling. That's all covered under regular Medicare Part A. The fourth thing that regular Medicare Part A covers is going to be home health care. We talk about Part B in a couple of weeks. We'll see home health care under Part B as well. The difference is that for Part A to cover home health care, you have to be in the same situation you were with skilled nursing. You have that 3 midnight rule. A great example of this is that I had a client who had a bad stroke about 2 years ago. He was in the hospital for about 10 or 12 days. Thankfully, he got better, but once he went home, he needed some speech therapy to be done in the home. Because he was in the hospital for 3 midnights, it was covered under Part A of Medicare and not Part B. So these are the things that are covered by Medicare Part A. So let's talk about exactly what Medicare Part A costs. So let's talk about your cost associated with Medicare Part A. As long as you have worked about 40 quarters, or what amounts to about 10 years, you don't have to pay anything for Medicare Part A. So there's no cost. However, if you've not worked about 40 quarters, or what amounts to about 10 years, you may be able to get free Medicare from your spouse. If you're going to get it from your spouse, there are 2 rules that go along with that. The first one kind of makes sense, because I've seen people get married for more dumb reasons than free Medicare. You have to have been married for more than 7 years. The second rule, and this is the one that maybe doesn't make a ton of sense, is that the working spouse has to be over age 60. I taught a Medicare workshop in Memphis, Tennessee, maybe 4 or 5 years ago at this point. And in that class, for whatever reason, there were a bunch of people in there who had worked for the United States Postal Service. Well, you may not know that if you work for the Postal Service, you don't have to pay into Medicare or Social Security. And so most of those folks were going to get free Medicare from their spouse. However, a few of their spouses were only 57, 58 years old, so they had to wait until their spouse was 60 years old before they could get free Medicare. So what do you pay for care? First off, I want to say that this is just regular old Medicare. This is without any insurance, so when we look at these numbers, don't have a heart attack on me. But before we ever look at any types of insurance, I believe it's important for you to understand exactly what regular old red, white, and blue Medicare covers and how much you would have to pay out of your pocket with that particular coverage. So the first 60 days you're in the hospital, you have a flat fee. You can think of it as a deductible, you can think of it as a copayment, but that flat fee is $1,676. So if you're in the hospital for 1 day or in the hospital for 59 days, it's still that $1,676. If you have to be in the hospital for more than 60 days, you do have a per day fee for the next 30 days, days 61 through 90. And that per day fee for days 61 through 90 is $419. If you have to be in the hospital for more than 90 days, you do have 60 lifetime days for days 91 through 150. The per day fee on that is $838. So it is $838 per day that you're in the hospital for those next 60 lifetime days. Now, once you use those 60 days, they're gone forever, but you still have 90 days of care per benefit period. Now, benefit period is where this gets a little complicated, and I know you're shocked to find out that something with the federal government is complicated. But that benefit period coincides with the day that you're released from the hospital. So let's say you're in the hospital today for a heart issue. They'd send you home. If you have to go back to the hospital for the next 60 days with that heart issue, you do not have to pay the $1,676 again. However, if it's been longer than 60 days since you've been released from the hospital, or if it's something else, if you've just had a good run of bad luck, and today it's a heart and next week it's a hip, you do have to pay the $1,676 again. The biggest thing to understand as far as what you pay for coverage when you talk about regular Medicare is that there is no maximum out of pocket. Okay, that's why years ago when I first got into this industry, 15, 16 years ago, you would see people that had just regular red, white, and blue Medicare, and you don't really see that anymore. They have an Advantage plan or they may have a supplement, okay? That way they can put a cap on their cost sharing where they have a maximum out of pocket. So what does all of this mean to you? Well, put quite simply, is that if you have just regular Medicare Part A, you do have some coverage for hospitalizations if you're admitted into the hospital, skilled nursing facility care, hospice care, and then also in-home care if you've been in the hospital for 3 midnights. But remember, this is when we talked about those numbers, those are just regular red, white, and blue Medicare with no other insurance. And so that is why you see, because of that no maximum out of pocket, you see that most folks will either look at an Advantage plan, maybe they'll look at a supplement, something of that nature in order to be able to put a maximum out of pocket on those costs. So what if you need more help? If you have more questions about Medicare Part A or even any other part of Medicare, feel free to reach out to us and we'll help you in any way that we can. We never charge for anything that we do here at AssureSource. And if you do reach out, there's a few different ways for you to do so down in the description of this video. If you do so, all those come to me and then I'll get you with the agent that is closest to you and best equipped to be able to deal with your particular situation. Well, again, we thank you for stopping by. We hope you learned something. If you don't mind, if you will like this video and subscribe to our channel, we'd really appreciate it. It helps us get in front of other folks who may be in the same situation that you are, and maybe we can help them as hopefully we have helped you. Well, I hope you have a blessed rest of your day. Again, thanks for coming. Bye-bye.